Sally again with Sally Cares. And today I thought I'd talk to you a little bit about medication management. I have 1,000 things to say about medication management, but this is a starting point. It's one of the hardest things to do. And people always think they're going to remember to take all their medications just because they have 10 bottles on the kitchen counter, and it doesn't work. People take their wife's medication. It's a real interesting thing when you don't have your medication organized specifically for you. One of the things I do is probably specialize in neurodegenerative disorders, meaning neurological problems that are a process, just like everything else is a process, but specifically Parkinson's disease. And this medication container is one that I always use with my Parkinson's patients. And I'm not getting paid to tell you which one to use, but I want to explain why I choose this one over others, because with Parkinson's, for example, most of them have to take medications 3 and 4 times a day, and it's at set times. If your doctor is that organized with your plan. Sometimes I've heard some patients say, well, my doctor tells me to take my medications when I want to. And look at my face. That's not really the idea we're promoting here. We like organization, okay? Because I know that your doctor wants you to do things a certain way, at least to give them feedback, so they know how well your medication's working. So the only way you know is when you take it, right? So I am familiar with this kind of organizer. I like this for a couple reasons. One is that it's labeled 7 days a week. This is one that's in the package, and Walgreens has their own, by the way. But this one, and there's larger ones than this too, that have the same idea, but there's, morning, noon, evening, and bedtime. And that's just dandy if that's all that matters. And there's no real specific time point that you have to take your medication. But with Parkinson's patients specifically, we do ours about, depending on what the medication is, 4 to 5 hours apart. And that's tough because people feel like they're taking medicine all day, every day. Now, what most people say that they do now that the iPhone has come into existence is that they set their alarm on their phone and they take it when it goes off. But I've had plenty of people tell me, but sometimes my phone isn't with me, or sometimes I'll turn off the alarm if I'm doing something and then I forget to go back and take it. So there are things that we can do to give us a visual cue to make sure we take our medicines on time. And I did this the other day for a patient of mine, and you can see that they take their medicine at 9:30, 1:30, and 5:30. And so it's kind of curling up on the edge here because I use this neat little label maker that you can buy anywhere. And I just made a bunch of 9:30s and a bunch of 1:30s and a bunch of 5:30s and cut it with scissors and then peeled that off and put it on the respective containers. So there is 9:30. Okay, now they're kind of coming up. So what I'm going to do, not waste my time here doing it, but is take some glue and glue them down, because you don't want them peeling back. You want them to stay there. Now, this is the beauty of this. What you do is you push the bottom, you pick this up and you put it in your pocket, or you put it in your wife's purse or something, and you take it with you. So when you go to lunch with your friends, you can't say, oh no, I left my medication in my container back at the house. No, you put it somewhere where you take it with you. And this size specifically fits in everybody's pocket. Believe me, I know. So this is how we go. And then you put it in. There's a little lip on the top of these, tiny little lip, and here that it connects with. So you kind of fit it in and then you click it into place and it holds. So when Monday comes, here's Monday. And sometimes, just to avoid confusion, I have people take this out, set this on the kitchen counter, and leave everything else alone, and that way they don't make a mistake. Okay? So that's one way to manage your medication when you have to take medication multiple times during the day. And that's my little story for the moment. And again, this is Sally Cares, and I would like you to click like and subscribe and share this video with anybody you know that's struggling with managing their medication, or maybe even have your spouse look at it and say, see, this woman says this is what you should do. I don't know how far it'll get you, but you can try. See you next time. Bye.